So minimally invasive surgery is a technology-based subspecialty of general surgery that allows us to perform major operations through small incisions. Sometimes we even use the assistance of a robot. The advantages of doing minimally invasive surgery are that patients usually experience less pain, not no pain, but less pain. They tend to have fewer complications, and they tend to have a much faster recovery and return to normal activity. So the robot is a device that has been in existence for about 15 years, and there have been several iterations of this over time. The latest technology allows us to perform surgery laparoscopically with the surgeon sitting at a robot control device called a console that's in the same room as the patient but not adjacent to the patient. A second surgeon is at the patient's bedside for a number of reasons. One is to place the laparoscopic instruments. Another one is to be available for immediate access if there were some unforeseen emergency. The operation via the robot allows us to scale the movements of the surgeon, and so if we are doing extremely fine dissection in a very tiny space, we can scale already small movements by the surgeon down to infinitesimally small movements by the robot. So it allows for much finer dissection in a smaller space. It also allows for some movements that the human hand just doesn't have. For example, the robot hand can spin all the way around 360 degrees over and over. Human hand doesn't do that. We have to catch and release, so to speak, and re-grab tissue and instruments to do that kind of a movement. It also removes any vibration. So even though most surgeons brag about their steady hand, every human being has a fine tremor. The robot eliminates that fine tremor. It also allows three-dimensional views of the operative field using a special kind of optics. And so when a surgeon is operating via the robot, it's almost like they're living in this virtual world inside of the body cavity where you're submerged in this three-dimensional view of human tissue, and it allows a perspective that we just don't get from any other operative technique. The reason I think that minimally invasive surgery is a benefit for patients is because they tend to spend less time in the hospital. The overall costs of their health care tend to be less because the risks of complications are lower and the return to normal activity is faster. Again, this isn't true for every patient and every surgical problem, and so we have to be really cautious in who we apply the tool to, but when it's appropriate, it truly provides a benefit and shortens care.